DocTalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.
Hey folks, welcome to DocTalk. Thanks for joining me today. Today we're going to talk about bovine respiratory disease. We're going to talk about everything from gathering the history on a group to what we're going to see in the pen to what we see in the chute. Going to be a good show. Stay tuned.
Bovolus Nasalgen 3 offers young calves unrivaled protection against devastating respiratory diseases, including IBR, PI3, and BRSV. And it has a unique blue shadow, so there's no second guessing which animals have been vaccinated. To up your protection, choose Bovolus Nasalgen 3 PMH, the first and only intranasal that protects against viral and bacterial pneumonia. Talk to your veterinarian and visit nasalgen.com to learn more.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thompson, and I'm an owner, practitioner, and production animal consultation, and I'm also a part-time, half-time faculty member at Iowa State University. Really a unique opportunity to help with education and maintain my veterinary practice. Today, we're going to talk about something that is something we deal with on a day-to-day basis, and I have some really cool video to share in a feed yard that I was at in Northwest Iowa. But as we look at disease in general, or we look at ailments in general in feed yards, you know, there's some stepwise processes as veterinarians and as producers that we really need to take a look at. And so when we start to see an increase in spike of morbidity in a feedlot or from bovine respiratory disease, if we're seeing an increase in lameness, or we get into the early fall and we start to see an increase in buller activity of cattle, you know, first thing we have to do is stop and take a history. And a history as a veterinarian, and you as a producer, you may think that I'm just going to walk in and automatically know that you're having a lice problem, or automatically know. I may have some observations, spending some time, but to really get to the root cause and really understand what's going on, as a veterinarian, the first thing I have to do is I have to sit down and get your perception on your operation of what's going on. I also need to know, has this been going on for a week? Has this been going on for 2 weeks? Has it been going on for a month? Really, really important. I also need to know, is it about the same? Is the same number of head, the same level of severity per animal? Or is this something that is going up in progression of disease or progression of severity, or including more animals? And so I think those are really, really important parts of the history. The other parts of the history are the signalment. And so I'll ask you, you know, is this affecting just the heifers, or is this affecting heifers and steers? Is it, if it's a cow herd, you know, is it age? Is it the replacement heifers versus the cows? And some of these different things. And then within the age, breed, gender, it might be the stage of production. You know, are these animals pregnant? Are these animals newly received to the feed yard, and where are they at on ration? And so those are some things that we'll ask. Some of the other things that I'll ask when I take a history is, I'm gonna, you know, what have we done vaccination wise? What have we done diet wise? What have we done with maybe dewormers, water source, environment? As we start to think about this, when I start to ask questions like, have we upped the roughage? No, we've stayed pretty much the same roughage level, but is it the same roughage source? Well, no, we're into a new cutting or a different type. We're out of the grass hay, we're putting a new green chop type alfalfa in the diet. Lots of different things that could be stimulating phytoestrogens and things to that nature as we look at some of these issues. Water source, you know, do we hit a dry time of the year where we can't source all the water from one pond, and now we're blending it from a well or from another source, and when did that occur? Environment, have we had, you know, rainfall? Have we had temperature fluctuations? All of these different things are going to go into the history before I start to come to some diagnosis and start to understand before I go out and look at the clinical signalment in the pens or in the pastures. History is vitally important, and more on that when we come back. We're going to take a message. You're watching DocTalk.
The cost of an open cow these days is very expensive. It's hard at times to dedicate a half a day or a whole day to leave your practice to go palpate cows. And so alertness test has helped speed the process up of getting preg rates back to the owners. And so free up time for diagnostics or working in your clinic. It also will help generate revenue, not being on site to do the testing.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrosyn by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it though. Go to macrosyn.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrosyn.
It's the crews, cattle, and accolades that keep you striving for the best that's ever been. It's more than a banner or a great calf crop. It's everything you deserve. And for that, we're here with all you need. valleyvet.com.
Hey folks, Dr. Dan here. Glad to have you with me here on DocTalk. I'm in Ames, Iowa, where I practice veterinary medicine. I teach and do research at Iowa State University. And as we're leaving, one of my favorite stories about not taking the time to collect a history was I had a new associate hired. We were in West Texas. He's a brand new veterinarian. We did a necropsy in front of the crew. We got done with it, and there was a little speck of BRD or pneumonia in the lung, and my associate veterinarian went through and explained the pathophysiology of bovine respiratory disease and how that progressed in the animal until the animal died. And he looked up and asked the person, the hospital, the doctor there, you know, what'd you think of that as far as the explanation of death? And they said, we thought it died because we hit it with the feed truck this morning. So it's really, really important to start with a history and have an understanding of what you're going through every day when we come onto the farm. So now let's go into bovine respiratory disease. And it's, you know, in the fall, it's the number one cause of illness, the number one cause of death in feedlot cattle. And so when the first thing that we have to do is identify sick cattle in the pen. And we have not done a very good job of being able to identify sick cattle in the pen, because cattle, until they know that we are caregivers, they will hide their clinical signs from us. And so, but once they start to get either so sick that they can't hide the clinical signs, or they trust us and show the clinical signs earlier in the disease process, the acronym we use for finding cattle that are sick with respiratory disease is DART, okay? Depressed, anorexic, respiratory, temperature. So in the pen, we can find animals that are depressed, or maybe they're alone, maybe they're by themselves. Their head's down, their ears are down, they aren't alert when you come into the pen. That's pretty obvious one. Anorexia. These are animals that are off feed. Anorexia means to not eat. And so if we start to see an animal that's gant or slab-sided, that's an animal that, whether it's truly sick or not, something's going on that we better get that animal in and check it out and take a look at it. Respiration rate. That's another thing that we're going to look at. Is this animal breathing heavy? Is it breathing fast? Has it changed compared to just normal respiration, meaning that there's something wrong with bovine respiratory disease. There are other things that we can examine in the pen, such as a dry nose or severe, clear, running nasal discharge, some of those types of things. But we can't evaluate the body temperature out in the pen, so we have to get them in. So understanding that is vitally important. Now, one of the things that we use on a day-to-day basis in our feedlots is we try to match, especially with high-risk calves, because not every calf will show these signs of depression, anorexia, and respiratory rate. We will use different methods such as walking those pens or riding those pens when we offer first feeding, especially as we get into these cooler months. And a lot of times that will expose those animals, and I have some video of how we do that I'm going to come back to here as we take a break. So let's take a break. When we come back, we'll have some video on how we identify some cattle. We'll also go through some things we do at the chute side to better evaluate and how to treat those cattle with bovine respiratory disease. You're watching DocTalk, and I'm glad you joined us.
DNA Dialogue is brought to you by Identity Beef, powered by Neogen.
When it comes to genomic technology and genomic testing for the commercial cow-calf operation, one of the biggest questions I get is why invest in the technology? And I think a lot of times the benefit of genomic testing is really the ability to peel back the calf's hide and really better understand the genetic merit of the replacement heifers that you're selecting. Because if we think about the biggest investment that a commercial cattleman makes, especially if he raises his own replacements, is to raise that heifer from birth to the age of 16, 18 months at preg check time to realize that she didn't get pregnant. And so one of my favorite conversations to have is really, let's talk about genetic variability. Because if we think about the monetary investment we make in a bull, right? You as a commercial cow-calf guy, you go to a bull sale and you do a lot of research. You phenotypically look at that bull, make sure he matches what you like, make sure his conformation is sound, and we hope that you look at the EPDs that come in the bull sale catalog. But what some people don't understand or even think about is that in that full sibling mating, there's over 1 quintillion possible combinations of DNA in a single calf that bull can make. And so that is what genomics brings to the table. We're able to look at the DNA that passed down from that bull into that heifer so that the commercial cattleman can select the females that are inheriting the genetics that he paid for.
We know how expensive it is to keep and maintain heifers. What is also the fallout of those heifers if they're not the correct ones you're keeping and maintaining. We want to do as much as we can to get it right before we spend the money to impact our herd further down that road and keep successive females out of the wrong type of females.
Identity Beef. Contact your Neogen territory manager to test today.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thompson here at Iowa State University, and I'm a feedlot practitioner that spends a lot of time in feed yards. And as we left, we're talking about finding cattle that are sick when we feed them. And here's a video that I'm going to share with you. This is at Hanson Feed Yards up in Hinton, Iowa. Rick and Patty Hanson, great people. This is Justin and Miguel that are out in the pen. You can see that the tractor's coming in and the feed wagon, and we keep these cattle pretty aggressive. And we're going to feed these cattle, and you're going to see that how aggressive they come to the bunk. and obviously they're hungry. And one of the things about using feed, a lot of times when we pull cattle, there's times where we pull cattle that are ugly, but they're not sick. And using the feed and how these cattle come. But then look at this critter standing out here all by itself. The only one in this pen of 200 and some head that's not coming to there. And sure enough, as any good caregiver would do, here comes Miguel up to take a look at this animal. This animal was, if we wouldn't have timed this at the time of feeding, this animal was full. This animal was alert, and this animal didn't have respiratory signs. So sometimes using feed can help us identify those animals that maybe are just a little bit off before they're held off feed too long, and then we're able to get these animals in the pen. So we're going to grab this animal. You can see Justin and Miguel are going to move him out of the pen. We're going to take him up to the hospital where we're going to put him in the chute, and we're going to do a physical exam on this animal. And as you can see, this animal standing here in the tub right now, pretty alert, got a belly full of feed, not one that when we described the DART method that we would have probably gotten if we wouldn't have matched this up with feeding. So the first thing I'll do when we get the animal in shoes, I'm going to look at the head. And I want to look at the eyes. If the eyes are sunken in, that means dehydration. If when we get chapped lips, when we get sick, cattle get a chapped nose. This steer has a severe nasal discharge that is watery, that sometimes we associate with a viral pathogen. Ears are alert, heads up. I'm going to go back then to the side, and I'm going to look and see if this animal is gant or not gant as part of my physical exam. And then, of course, we're going to go in there, and you can see where Miguel is right here, taking the rectal temperature or the body temperature, and then sure enough, this animal temped 106.0. Normal body temperature for bovine cattle, especially in the fall, because it's not going to fluctuate, go up because of heat stress, is 101.5 to 103.5. Anything that's 104 or above running a fever, we're going to consider that animal to be having some sort of viral or bacterial disease, and that is an abnormal body temperature. But not eating, alone in the pen, physical exam, sunken eyes, nasal discharge, not eating, rectal temperature of 106, we're gonna treat that animal. So when we come back, a little bit more. We're here at DocTalk. Thanks for joining us.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
When a new calf hits the ground, the clock starts ticking. A belly full of colostrum gives them their best chance, but if they don't get any, time starts running out. That's when you grab a bag of Oxford Ag Colostrum in their patented feeding system. It's simple. You fill it with warm water, shake it to mix, feed it with a tube or a nipple, and you are done. No bucket, no bottle, no mess, and right on time. Ask for it by name wherever animal health supplies are sold.
Success in the cattle business hinges on a lot of different people playing their part. From the vet to the cowboy and the nutritionist to the feed truck driver, you rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to BimetaBiologicals.com to learn more.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thompson, and we're talking about respiratory disease. And You know, while we're there, we pulled another calf to the chute, and I'm just going to kind of walk through our physical exam and what normals are and abnormals. But the first thing is I'm going to look at this calf's head. And as you can see in this video, its eyes got some discharge. They're sunken in. You can see that when you look at the nose, there's the constant nasal dripping, that clear nasal. I don't get as shook up about just a mucus plug or somebody blowing their nose, but when it's constantly running like this, it's something that's abnormal. We'll also look to see the nose, and a lot of times we'll see a dry nose in these animals. Then I'm going to move back to the back end. We're going to take the rectal temperature of this animal, but I'm also going to examine as you can see here, I'm going to examine the lumbar fossa area, and you can see that this calf has been off feed and not been eating. So this is the anorexia. So normals for cattle, normal rectal temp is 101.5 to 103.5. Normal respiratory rate in a bovine is 10 to 40 breaths per minute. Normal heart rate is 60 to 80 beats per minute, and normal rumen contractions are 1 to 2 per minute. And you're like, well, how do I measure rumen contractions? Well, if you don't have a stethoscope and you can't listen to them, you can actually take your fist and put it right in this left paralumbar fossa, and as you press down, you'll actually feel the rumen contractions as they move underneath your fist. I'm going to look at respiratory rates. I'm going to look at the head. I'm going to look at the paralumbar fossa. I'm going to take a temperature. And then once we have that, we're going to take this to the animal health computer. As you can see, Justin, he's going to enter this information that we take, whether it's a lung score through auscultation or whether it's a body temperature. We're going to put that into the animal health computer, where as a veterinarian, I have set up our treatment programs based on the signalment, which is age, gender, days on feed, things to that nature, along with the clinical definition or the clinical signs. What did we see as far as lung score, rectal temperature, and then that will then give Justin and Miguel the treatment protocol or the treatment plan for this critter that's in the chute. And you can see, and then we administer the product, and then hopefully when we send this animal back to its home pen, it's going to not come back to us for a second treatment and get along just well. What do we expect from our treatments? We expect 80% of the animals that we treat first with respiratory disease to never come back for a second treatment. Of those that come back for a second treatment, about 50% of those come back for a third. And of the ones that come back for a third treatment, about 50% of those go on to normal pack. The other 50% wind up being railed or died. So as we look at this and measure our case success, and constantly look at these numbers, these are some of the things that you should do when doctoring the cattle with the right clinical case definition and the right treatment protocols, working underneath a valid veterinary client-patient relationship. Sure appreciate you watching DocTalk today. Remember, if you want to find us on the web, you can find us at www.doctalktv.com. Always work with your local veterinarian. I'm Dr. Dan Thompson, and I'll see you down the road.
DocTalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.
Stressors that trigger bovine respiratory disease are all around. So when you spot BRD in your herd, turn to Zuprevo, the fast that lasts. Zuprevo is rapidly absorbed in as little as 45 minutes and lasts up to 28 days. Because in the race against BRD, you need to win. Ready, set, Zuprevo. In case of human injection, seek immediate medical advice. For use in beef and non-lactating dairy cattle only. For prescribing information, talk to your veterinarian or visit Zuprevo.com.
One of the most core principles in the beef business is reducing risk. We have eliminated and reduced the risk of animals not performing up to our expectations through the use of EPDs, through the use of genomic testing. I've gravitated toward the Angus GS, using it. You've got all the right people in the room when you've got Neogen and AGI working together. That's what puts my confidence in the Angus GS test. Cattle producers have always been sustainable. We have no choice but to be sustainable. But however, this is another tool to identify the most efficient animals, which take less inputs, less resources, and produce more beef with less inputs, less resources than ever before. And I think the evolution of genomic testing is vital to the cattle business.
Angus GS, powered by Neogen, is the highest industry standard in genomic testing for your whole herd. Contact the American Angus Association or your Neogen territory manager to test today.
From sunrise feeding to midnight calving, it's planning and prepping every last detail so your family can enjoy the finer things in life. It's careful feeding, impeccable breeding, and herd health protocols to keep your slice of the industry forging ahead. More than just a website or print catalog, we're a dedicated partner with everything you need, right when you need it. valleyvet.com